Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is August 14th, 2020. As always, we start with our COVID-19 statistics. Worldwide, we have over 21 million cases and over 760,000 deaths. In the United States, we have nearly 5.5 million cases with over 170,000 deaths. We'll start today with news on face masks. First, researchers have found that 50 minutes in an electrical cooker, such as an Instant Pot, can sanitize an N95 mask. It's likely that the same process would also work for cloth masks. As long as they fit, multiple masks can be done at once. There are two important things to remember, however, if you're going to try this at home. First, do not put any water into the electric cooker. Second, make sure that the masks do not touch the bottom or sides of the pot, or the top for that matter. Use a trivet or a small bowl inside the pot to keep it up from the bottom, and then just be careful that it doesn't hit the sides. In other news on face masks, a small study was done to determine what types of masks are the most effective. Unsurprisingly, N95 masks without vents were the most effective. Surgical masks were nearly as effective as the N95 masks. Cloth masks made with 3 layers, including cotton in at least one of the layers, were also quite good. Bandanas weren't that great. Better than nothing, but not great. They're really quite thin. You can layer them up a bit to help, but the material itself isn't the greatest. Fleece actually turned out to be worse than having no mask at all because of the way it breaks apart the water droplets coming out of your mouth. It makes them into smaller droplets instead of just blocking them, so it tends not to work very well. We do want to point out that this study was very small. There wasn't a whole lot done to make sure it was really robust or anything. It was just very small, very few samples done. This is definitely not something that we would say is a study that we need to completely 100% follow. Most of the results went along with results from other things, and so those parts are fine. For example, the masks that worked well, those have all been backed up by other studies. The fleece part of it, though, causing it to be worse than not having a mask at all, that's brand new to this study. As far as I'm aware, no other studies have actually checked to see if fleece works or not. So that one, it may be true that fleece makes it worse, it may not. We just don't know yet because it's just the one study, and again, very small study, very small sample size, so it very well could be that this is just some error in the way the study was done. For the time being, we recommend using a mask that has been studied has been in multiple studies and has been shown to be effective, such as the surgical masks or the cloth masks with 3 layers at least, and cotton in at least one of those layers. Also, non-vented N95 masks are good, but we still, as much as possible, want to keep those available for healthcare workers. In other COVID-19 news, a study has now shown that the COVID-19 virus, the SARS-CoV-2, can survive in aerosols, meaning tiny, tiny droplets, smaller than the typical water droplets that you would produce in speaking and coughing and sneezing, though you do produce some aerosols in doing those activities. Aerosols can travel long distances and stay in the air for hours, unlike the normal droplets, which typically drop to the ground within 6 feet. That's why we recommend 6 feet for social distancing. And also, they fall to the ground, they're done. That's it. Previous studies had shown that the viral genetic material could be found in aerosols, but this study showed that the actual live virus could also be found in aerosols. It's still debatable whether there's enough of the virus in those aerosols to actually transmit the virus to other people, where people would get enough of a viral load to actually get sick from it. But other studies have suggested, though not completely proven, but they have suggested that it is very likely that there would be enough, and they have suggested that in some cases it seems like aerosols really are causing some of the transmission and spread of COVID-19. What this means for all of us is that in areas or buildings that are enclosed, smaller spaces, confined spaces, we may need to be even more careful than we have been. Larger buildings, large stores, things like that, you're probably still fine with a 6 feet distance. But in smaller areas, these aerosols may be able to travel further distances without being interrupted. And so you would be more likely to actually get some of the viral load into you, without being very, very close to someone. So we do need to continue wearing the face masks. Face masks don't seem to be quite as effective on aerosols as they are on the larger droplets, but face masks are still at least somewhat effective on aerosols. And so, a mask is definitely better than no mask. It is still believed that the main way of transmitting the COVID-19 is through the larger droplets, and so most of it is going to be through being close to someone within 6 feet of someone while they're speaking or coughing or sneezing, and we inhale those droplets or get them into our nose or mouth or something. That's the main way that it's transmitted. Aerosols would be just a small part of that spread of COVID. Researchers are actually developing a nasal spray now that they hope could offer protection against COVID-19. It wouldn't be a cure, but it would hopefully block the virus from attaching to human cells. The spray is still fairly early in development, but they hope to have it available by the end of the year. That could be an important stopgap measure before the vaccines are widely available for everyone. The CDC has released new information about excess deaths this year. The term excess deaths refers to the number of people that died over the amount of people they expected would have died. Say for example, in a normal year, you have so many thousand people that normally would have died by this time of, in a normal year. Then this year, maybe more were more dead, so that's the excess deaths. So this year, our excess deaths are at about 200,000. It's based, the calculations were based on historical data for the last 3 years, and they also took into consideration the seasonal patterns and the typical lag in reporting deaths. So the last 3 years, they basically took an average of those to figure out what a normal year would be. So because it's around 200,000, but that's about 30,000 more than the death count from COVID-19 in the United States, that means that there's something going on. There could be that the CDC just messed up in their calculations. It's unlikely. They're a very professional and scientific organization, plus they provided a probable range, which would still be between 16,000 and 35,000 deaths, more than what they were expecting, just from COVID. And so that's less likely. More likely are one of two things, or possibly a combination. One is that deaths from COVID-19 are being underreported. Contrary to the many conspiracy theories on the internet, doctors are not paid more to put COVID-19 on the death certificate. That just doesn't happen. If anything, deaths from COVID-19 are probably underreported, either due to clerical errors or because of a lack of testing, and so they're not able to verify that the patient did have COVID-19. So oftentimes they won't put COVID-19 on the death certificate, even though that probably was the cause of death. The other likely explanation for so many excess deaths is that COVID-19 has caused people to die from other conditions that normally would have been treated. So, for example, it could be because hospitals are too busy, too overcrowded, as has happened in some states, or it could be that people are too scared to go to the hospital or the doctor to get treated for something because they think that they're going to get COVID-19 if they go there. Either way, whatever the cause of these excess deaths, it does show that COVID-19 is dangerous. It also discredits a lot of conspiracy theories. The biggest COVID-19 news this week is about children and the reopening of schools. First, a study has found that children who are infected with COVID-19 do have just as much virus in their nose and throats as adults do. In fact, in children under 5, they can have up to 100 times as much virus as adults. So it's not that they're getting less virus in them. That's not the reason why it seems that they have lower symptoms or less severe symptoms. Also, just because they have more virus in them, this doesn't necessarily mean that they will spread it more. It's still concerning though, because it's definitely a possibility, especially now with everyone going back to school. In addition, throughout the United States, cases of COVID-19 in children have been increasing dramatically. Children cases in the U.S. as a whole have nearly doubled in the last month alone. Some areas have seen higher increases than that. While the exact cause of the increase is unclear, some possible reasons are increased testing, less compliance with CDC recommendations, especially due to traditional end-of-summer activities like vacations or camping trips or summer camps or other things like that. And also some children are already going back to school. Speaking of going back to school, many schools have started to open in the last couple of weeks, and it's generally not been good. The worst hit schools are those which did not implement any of the CDC's guidelines. And a particular note are schools in the state of Georgia. One school district has already had to quarantine over 800 students and staff due to COVID-19 exposure. They've reported at least 40 new cases of COVID-19. The White House administration, the coronavirus task force specifically, has warned that Georgia needs to expand its efforts against COVID-19 because current measures are not working. They've even suggested adopting a statewide mask mandate. Please, if your children are going back to school, push for the school to follow CDC guidelines. It's really important the guidelines are followed. Make sure your own children wear face masks when they go to school. Make sure they comply with the social distancing, and make sure that they're washing or sanitizing their hands regularly. If you are able to homeschool your children, or if your school offers online options for schooling, you may want to consider it. There are many factors to think about when making these decisions, but homeschooling is a viable option for many families. In other news, there's a recall for oranges, potatoes, limes, lemons, and some prepared foods which could be contaminated with listeria. Wegmans is the hardest hit grocery chain because of the supplier the recalled items are coming from, but other stores could also be affected. Please see the link below the video for a complete list. A new, robust study has found that eating plant-based burgers is healthier than eating the real meat equivalents. The study was quick to point out that plant burgers are not necessarily healthy in and of themselves, just because of all the processing they go through and all the filler ingredients that are added to them to make them taste like meat. But when compared to the real meat burgers, they actually are healthier, surprisingly enough. During the study, those eating plant-based burgers lowered their bad cholesterol, lost a little weight, and reduced levels of a chemical called TMAO, which is linked to cardiovascular disease. Generally speaking, eat more plants, less meat, and if at all possible, avoid processed foods. So plant-based burgers are typically processed, quite highly processed, so avoid them, but they are better than the meat variation of it, the original meat variation. Finally, CDC Director Robert Redfield warned that this fall could be the worst one we've ever seen from a public health perspective. The main reason he believes that is because we will still be fighting COVID-19 when fall comes around. It's right around the corner. But we will also start to see the seasonal flu kick up like it always does around this time of year. He stressed the importance of everyone getting the flu vaccine. He said even if it's not 100% effective, which the flu vaccine never is, but it does help quite a bit most years. Most years it is fairly effective. And he said even if it's not very effective, if it happens to be one of those years where we're just off on the flu vaccine and it's only, say, 30 to 40% effective, even when it's that low, those who get the flu, even after getting the vaccine, will have less severe symptoms and less likely chance of being hospitalized. one of the main reasons that this could be really bad if people don't get vaccinated against the flu is that if people end up having to be hospitalized due to the flu and the hospitalization or the hospitals are already full, because of the COVID-19 patients, we're going to have a lot more deaths that could have been prevented if those hospitals were not full. So please get your flu shot this year. Thank you for watching the Plain English Public Health Weekly Report for August 14th, 2020. I'm Richard Greenland, and you have a healthy weekend.